Imagine experiencing new, alarming symptoms and wondering if it is a normal part of your multiple sclerosis journey or something for more urgent. It is a common concern to feel uncertain about when to seek immediate medical help for your condition. For most multiple sclerosis symptoms, a visit to the emergency room is not necessary, as many flares can be managed by your neurologist or Ms. Care team. However, certain severe or rapidly worsening symptoms do warrant immediate emergency medical attention. Understanding the nature of your symptoms is key. Ms. relapses, often called flare-ups, typically develop over hours or days, lasting 4 weeks or months. These usually do not pose an immediate life threat but requiring professional assessment. On the other hand, symptoms indicating a stroke, severe infection, or other acute conditions can mimic Ms. and demand urgent care to prevent serious complications. Your Ms. Care team is best equipped to guide you through typical flare-ups, but recognizing true emergencies is vital. First, assess the severity and onset of your symptoms. Ask yourself if the symptom is new, severe, and came on very suddenly, like within minutes or an hour. Or did it gradually worsen over a day or two? Sudden, severe onset is often a red flag requiring immediate attention. Next, consider familiarity. Is this a symptom you have experienced before as part of a Ms. flare-up that was managed without an emergency room visit? Or is it entirely new and unusually intense? Finally, look for specific emergency room red flag symptoms. Seek emergency care for symptoms such as sudden numbness or weakness on one side of your body, severe headache that comes on suddenly and is unlike any you have had before, vision loss that is sudden and complete in one or both eyes, difficulty speaking or understanding speech that appears suddenly, or sudden loss of balance or coordination leading to a fall. Additionally, any signs of a high fever with neurological changes or an unmanageable infection should prompt an emergency room visit. It is incredibly helpful to have a pre-established action plan with your neurologist. Discuss with them which symptoms they would consider urgent enough for an emergency room visit versus those that can wait for an urgent appointment or an after-hours call. Many neurologists provide specific guidelines or an emergency contact number. Remember that emergency room doctors may not be Ms. specialists, so be prepared to clearly communicate your diagnosis and recent changes in your condition. By understanding the difference between a typical Ms. flare and a true medical emergency, you empower yourself to make informed decisions and get the right care at the right time. This proactive approach ensures your well-being and helps manage your multiple sclerosis journey with confidence and peace of mind.